Hello again, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, and I welcome you to the 58th edition of our COVID-19 community briefings. Well, if anyone ever wanted to know what community spread was like in a pandemic, now we know. We're in community spread at this point, and I'm going to be talking through a number of statistics with you and a number of most recent developments that we have and steps moving forward. So let's jump right into it. Sioux County have 1,538 positives as of this morning of the 7,262 tested. That is a 21.2% rate. Very high rate. The last time we talked was 19.8. Now, a little bit of caveat, and I'm not in any way dissing the numbers here, but we do know that there are a number of antigen tests, which is another version, a different testing platform in addition to PCRs. We have several hundred of those throughout the county that have been utilized and tested. And for some reason, those are not showing up on our numbers. So we still have a very, very high rate. It's not quite as high as what it shows, but it is nonetheless high. And the antigen tests, there are several hundred of them out there that we know about for sure. And those tests for us have been running probably less than 1%. So I don't want to confuse the issue here, but I do want to give a little bit of a silver lining that while the numbers are still very high, no question about it, we do expect them to go down once those antigen tests get included in our numbers. Another high rate, even a higher rate, and one where we still are number one in the state, is at the 14-day average on an average basis. We're at 31.2%, clearly number one in the state at that point. Lyon County, number two at 27.5. Osceola County in Northwest Iowa, number three at 27.3. So the top three counties in the state are in relatively our neighborhood. There are 35 counties in the state that have 10% or higher positivity rate. That is up from 32 counties when we spoke on Monday. Region 3, we have 78 hospitalizations currently, up fairly substantially since we spoke on Monday at 63, so we've had a 15 increase there. We also have 15 people in the ICU currently in the 20 hospitals in Northwest Iowa. That number was 12 before. We've also had 22 admits during the last 24 hours. In Region 3 continuing, we have 7 ventilator patients, but 71 vents are still available. That'll be important for later on in my discussion. We also have 85 ICU beds available. So availability is not an issue, but we'll talk a little bit more about hospitalization as we measure acuity and what that means in terms of Sioux Falls and Sioux City markets. Iowa has 84,430 positives out of 765, over 765,000 tested. That is an 11% positive rate. That number also is going up slightly. It was 10.9% the last time we talked on Monday. Just as an aside and as a little bit of a follow-up to my earlier comments on antigen tests, the state is including 20,221 antigen tests as well. So they're just behind in getting ours keyed in. And so there are thousands of these tests out there in the state, north of 20,000. And like I mentioned, there are hundreds of tests here that need to be recorded yet. but again, our rate is still very, very high. I want to talk about hospitalizations in Iowa now, 276, and that is as of September 23rd, which is the most recent number that's posted on the coronavirus.iowa.gov website. That number is up from 249 on Monday. 9 are reported for Sioux County. That number today is higher. I mean, I can tell you that for sure. There are more than 9 Sioux County patients hospitalized somewhere. That number, but officially on this website, it was 9, and that previously reported was 7. Plymouth County 4, O'Brien County 8, Lyon County 1, Woodbury County 16. I can also report that Woodbury's numbers are higher today than 16. But again, this is as of 9/23. Woodbury County's number were 11 previously, and again, 16 as of today's data. Polk County was at 26, and they were at 21. So definitely an uptick in hospitalizations, but even more so on 9/24 and 9/25, which is today. I want to shift a little bit to a meeting that was held this morning. And because of the increase that we've seen as a result of community spread and the number of our staff members who are out, either having tested positive or in quarantine, the 4 health systems in the county who are collectively experiencing about 80 absentees from coworkers or workers, and either tested positive or in quarantine. So in rural facilities, we have staff, but we don't have a deep bench. So for example, we have 4 respiratory therapists in an Orange City area health system. If just one of those tests positive, that's a 25% reduction in our staff. So that's just an example of what I mean by not a deep bench. And we need to make sure that we do everything we can to make sure our healthcare workers are here to take care of all of us. So in response to the community spread and status throughout the region, which I'm going to talk about in a little bit, we met this morning with school systems, all public and private school systems in the county, including Northwestern and Dort, including Community Health Partners, and including Promise Community Health Center as well. And we just wanted to send one message particularly home, and that is our assessment of the current environment. In other words, what's going on in the area. We wanted to impress upon educators and administrators, board members, the status of things going on, and solicit their help, ask for their help in doing whatever they can do to help us limit the spread. And not so much from the standpoint of the kids. I mean, while the kids are positive, by and large, the kids are not the ones becoming ill. The ones becoming ill are more the teachers and the parents and grandparents, some of which are our staff, some of which care for you. And so we wanted to solicit their help. First of all, provide them with information, and then secondly, solicit their help. Some of the information and one of the things that triggered the invite to this meeting was news that we received from Sanford Medical Center that they were no longer accepting transfers from what we would normally transfer to them in a COVID-related situation. That's a very unusual thing. And not only is Sanford Medical Center Sioux Falls doing that, but also Bismarck and Fargo, sending patients to Aberdeen as an example. And so this is a pretty rare thing. And so it's really hitting we're on the southern edge of it, but it's really going up north into North Dakota, clearly. Sanford is not the only facility in Sioux Falls. Obviously, Avera has more patients than Sanford does from a COVID standpoint at this point. And we're denied a transfer yesterday to St. Luke's in Sioux City. Not so much because they're full at this point, but they had a particular bottleneck yesterday. And so on occasion, we're going to receive that too. They're under stress as well in Sioux City. And we just wanted to make everybody aware of that. Also want to make sure that the community knows that we are doing everything we can here. Excuse me. Relative to keeping patients, we are increasing our negative pressure rooms that we use for COVID patients. We had 4 of them. After about another hour from now, we'll have 11 of them. Currently, we have 6 patients in our hospital with COVID. We are able to treat patients with therapeutics beyond what we have normally treated here. Includes convalescent plasma and other drugs like remdesivir and so forth. So we are capable of doing that. We are doing that. What we will still have the ability to do is in the cases of ventilator assist or or high flow oxygen need, we will have the capacity to get patients out to appropriate places, either Sioux Falls or Sioux City for those services. But we are keeping more patients here. Just wanted to be very clear and transparent with that. Lots of questions still out there regarding testing, and you may have seen an announcement, or if you haven't, this might be a way to look into it a little bit further. Beginning next Monday morning, and every Monday through Friday from 7 to 9 a.m., we'll be offering a Test Iowa option for anybody that wants a PCR COVID test. Those do not require appointments. Those do not require a healthcare provider's visit. Those will be available every weekday from 7 to 9 a.m. in our OC Health department, which is located on the west end of our hospital campus here in Orange City. In addition to the walk-in status of that from 7 to 9 a.m., we will also offer appointments from 9 a.m. to 3 p.m. Daily, Monday through Friday. We ask that patients do not present to the ER asymptomatic, meaning no symptoms, and wanting a test. We've had that from time to time, sometimes at 1:30 in the morning, and we really ask that our ER staff is reserved for symptomatic patients, and we'll take care of those patients, but please don't show up without symptoms and ask for a test, because you will not receive one. Hopefully, that desire will be filled with our Monday through Friday Test Iowa sites. I'd also like to point out that the care that's being provided for our seniors in our community, the most vulnerable of our population, particularly those in the nursing home, we do provide twice weekly now testing of all residents and all staff in our nursing home. And to date, we've only had that one incident where we had a couple positives, but so far we've been very fortunate that we've been able to keep this virus out of our nursing home. So kudos to our staff out there for all the PPE that they've been doing, all of the protocols that they've been following, and again, our empathy to families and our empathy towards the residents for being in a situation where they're isolated from their loved ones This is not a good situation by any stretch of the imagination, but it is good that we're keeping the virus out of the nursing home, and we need to continue to do that. This will continue for the foreseeable future. As we talked about duration with the school administrators this morning, we basically said, we're going to evaluate things a week at a time. And there isn't a magic number if we drop from 30 to 25 or to 20, where all of a sudden we can go back to normal. We don't know what that number is. We do know we can convert back to some degree of normal when we see it. We will know that when it happens. Simply can't predict what the magical percentage number would be during that, for that point. So we remain concerned, not alarmed. We are making contingencies, and we are able and very prepared at this point to take care of all of the needs that we have. And when they go beyond us, we still have the capabilities of making sure that those needs are being met as well. So I think that's it. I'm going to go get a drink of water, and I wish you all have a great weekend. But please be extra vigilant right now, extra vigilant. Wear your mask every time you're out in public. Keep your social distancing. Limit your travel, limit your group exposure, complete your hand hygiene, washing, disinfectant, all of the above, all the things we've been talking about. More than ever, now is the time to do that. We will get through this. We're doing all right. Hang in there. Have a great weekend. Be strong, be vigilant, and above all else, stay healthy. Thank you for joining us.